Hi, my name is Cam McCormick. I'm a senior staff therapist here with Excel Physical Therapy and Fitness. We're here in Glen Mills, Pennsylvania. I've been here in this office for going on 7 years now, and what I wanted to do was take a couple minutes, tell you about how we're incorporating kettlebell training into some of our rehab principles. Now, the kettlebell's been in the news and the media quite recently. It's kind of the big fad and everybody wants to do it. And it's really just a different tool to use. There's nothing magical about it. What's unique about it is the thick handle and the offset center of gravity, as opposed to holding a dumbbell that has a very symmetrical center of gravity. One of the reasons I've chosen to pursue kettlebells as part of my physical therapy career is not so much we need to use a kettlebell, but there's techniques and movements that are unique to the kettlebell that help facilitate some reflex stability throughout the body. What I want to do next is I'm going to take you through the 7 steps of the Turkish get-up. There's a lot of things going on, so I'm going to go through it first. I'll break down each step, kind of what we can use each piece for. This is a 16 kilogram kettlebell, it's about 35 pounds. We're not actually going to use this with patients right away, but I'm going to use this now just for demonstration's sake. Okay, so I'm sure many of you are thinking there's no way I do any of that with one of my patients. But what we'll do is we'll actually use certain stages of it with or without the resistance part. So, for example, you'll notice that during any step of the get-up, I'm really just moving my body underneath a fixed weight. So, in theory, you might not get a better shoulder stability exercise than learning the steps of the get-up. So here, if I don't have full shoulder extension and I have any kind of weight, my arm is going to tip forward. So I've got no rotator cuff or scapular stability. Likewise, we can actually use some lower half and core training in these first few steps. So I'm not actually trying to perform a sit-up here. The first step is I'm rolling from my hip into my opposite shoulder, basically creating a link across my body. From here, moving into a high bridge continues that cross stability and is an excellent way to get glute firing into what's called the high bridge. That first 3 steps is one of the keys that we'll actually use with a number of patients, whether it's a back patient at high level close to discharge, a shoulder patient working on stability. So these first 3 steps we'll tend to use a lot. Now the transition from high bridge to post, we don't do a lot in terms of rehab, but we will use the transition from half kneeling to standing, again with or without resistance depending on the patient, in order to maintain full hip extension, teach a reflex stability through the spine, and make sure we have full shoulder mobility. What we'll often do, because I don't have one handy, but what we'll do for patients that are advanced, that are essentially out of pain at this stage, is we'll teach them to do the same exercise with a shoe balance on their fist. So I've got no weight, I've got imaginary shoe in my fist, and until they're able to perform at least 50 repetitions without the shoe falling on their face, then there's no reason that they won't want to do anything with a weight yet. And that's at least a few of the things that we'll do with the get-up with or without a kettlebell.